Imagine your doctor's office, or maybe a hospital. They're doing vital work, right? But what if a small admin error caused huge financial problems, tied up their staff, maybe even affected future care? Today, we're diving deep into something called the clean claim. Sounds technical, I know, but it's absolutely critical for healthcare in the U.S., our mission. To unpack what it is, why it's just so important, and how it ripples through everything from hospital budgets to, well, your own medical bills.
Exactly. So a clean claim, at its heart, is basically a medical insurance claim that's accurate, totally complete, and error-free. And crucially, it meets all the insurance company's requirements on the first try.
First try. Yeah.
Yeah, that means, correct patient details, provider info, valid codes for diagnoses and procedures, any attachments they need like prior authorizations, and it has to follow the payer's specific formatting rules. The key thing is, these claims don't need anyone to manually step in and fix things after they're submitted.
That sounds simple enough on the surface, but why is getting it right the first time? Why is that such a big deal? What makes it so important?
Oh, it's fundamental. Absolutely fundamental for, well, quite a few reasons. The impact is massive. First off, faster reimbursement. Simple as that. Clean claims get processed and paid really quickly, often within, say, 15 to 30 days.
15 days. Wow.
Yeah, which is huge for the provider's cash flow.
Yeah.
Think of it, if claims get stuck because of errors, a hospital might have to delay buying new equipment or even just struggle to pay the bills.
Right. So it's not just about getting paid eventually. It's about keeping the whole financial engine running smoothly day to day.
Precisely. Second big thing, reduced administrative costs. Fewer mistakes mean less time and money spent fixing things, resubmitting claims. Estimates suggest that dealing with denied or reworked claims cost the U.S. healthcare system billions every year. Billions in just administrative waste.
Billions. That's staggering.
It is. Clean claims fight that directly. It eases the load on billing staff, on customer service. Then third, there's improved compliance. Getting it right ensures you're meeting IPRA standards following all the specific payer rules. That lowers the risk of audits, penalties for improper billing. It's serious stuff. Fourth, a higher first-pass resolution rate.
Yeah.
This just means a high percentage of claims get paid the very first time they're sent in. The industry benchmark, aiming for 95% or higher, which is frankly quite ambitious given how complex and changing the rules are.
95%.
And finally, maybe most relatable for listeners, better patient satisfaction. When claims go through cleanly, you, the patient, get accurate bills. That means less confusion, fewer of those frustrating phone calls trying to sort out errors, just a smoother experience overall.
That really paints a picture. It sounds like the stakes are incredibly high if things go wrong. So, flip side, what happens when claims aren't clean? What's the fallout?
The risks are definitely significant, and they can pile up fast. You get immediate claim rejection, for starters. That means delays, payment holdups for the provider. You'll also see more claims flat out denied, which often means lost revenue, maybe even write-offs, money the provider just never gets back.
Ouch.
Yeah, and that denial means more work, increased operational costs because staff have to investigate, fix, and resubmit, doing the work twice, sometimes 3 times. And maybe the most serious risk, compliance problems. Mistakes can trigger audits from payers, and that can lead to hefty financial penalties. I remember this one clinic, a small place, had a claim held up for a month because of one wrong digit in insurance ID. Seems tiny, but the knock-on effect was huge for them.
Incredible. Just one digit. So, to avoid all those headaches, what are the absolute must-haves? What are the core parts that make a claim clean?
It really boils down to precision in a few key areas. First, patient demographics, name, address, date of birth, all that needs to be complete and accurate. Second, insurance information verified, current, active policy. Third, valid codes. That means the right CPT, ICD, and HCPCS codes. They're like the universal language for billing procedures and diagnosis.
Yes, the codes.
Then, provider credentials, they need to be registered and up to date. Fifth, the format using the right billing form, like the CMS 1500 or the electronic 837P, exactly how the payer wants it. And finally, attaching all the required documents, things like referrals, prior authorizations, everything needs to be there. The goal, really, the industry aims for a clean claims rate of 98% plus. That's what you need for optimal revenue cycle performance. Getting to that 98% across thousands of different payer rules, it's a constant challenge.
Wow. So what started as looking into the seemingly small detail, the clean claim, it's really shown itself to be the bedrock, the foundation for efficiency, financial health across the whole U.S. healthcare system. It impacts providers and patients directly, really makes you appreciate all that unseen work keeping things afloat.
Absolutely. And it brings up an interesting thought, maybe for you, our listener. If this level of precision in just one administrative document can have such a profound impact on a system as complex as healthcare, where else, maybe in your own work or industries you follow, might seemingly minor details or processes hold that kind of disproportionate power for efficiency and success? Something to think about.